All right, folks, this is day one. I'm here at the cancer center. Like I said, this is day one. Getting ready to go in for my first chemotherapy appointment. This is going to be an all-day appointment. I'm hoping to add to this video when I'm done today and give you guys an update of what I went through. Talk to you in a few minutes. Hello everybody, this is Delbert Odd. This is video of the end of day one of my cancer adventure. If you watched Cancer Day Zero, you should know that I was diagnosed with cancer a little over 2 months ago. Had some events in my life that I had to get stable, get into an apartment where I could be in the same place and be able to handle some of the challenges that I might be going through. Earlier in this video, I outlined that I was going in for my first cancer treatment. I did that. When I got to the office that morning, they took me to the room where they dispense the cancer medicine. There was a whole ton of us there as new patients. We sat and watched a video for about an hour. Then some of the people left. For me, I waited around maybe 10, 15 minutes, and they took me to see the doctor, who checked my progress between our first meeting, which was an emergency meeting because I needed to relocate from Orange, California to Las Vegas, where I live. He was very personable. He talked about the cruise that my wife and I went on that caused us to delay in being able to get treatment. He discussed, anything that was going on with me, asked how I felt, confirmed the medicines that I was going to start on. Very comforting. No real shock there. He said all my blood work was fine. I was then taken back into the cancer room, or wherever the room where they dispense the medicine. The nurses were very friendly, very personable. Sat down again, talked about the medicines, talked about how I was feeling. Explained to me along every single step exactly what they were going to do. For me, I had a port put in a little over a week ago. When it was first, the port is a device that sits under your skin. In my case, it has a tube that leads up to my jugular here. You can see part of it here where there's some bandages over it. The port allows them to stick the needles to draw blood and to get the medicine into me through that device rather than giving me an IV every other week. The medicines that I'm on are Folfox, and I've got to be on it for 6 months, 12 treatments. Didn't know what to expect being my first visit, but I can tell you everybody made me feel really, really comfortable. The nurse explained to me that the first couple of shots into the port, because you are going through the skin, they're a little bit of a stick. She said that it was far less than getting an IV or a shot, and I happen to agree with her. I would tell anybody that has to go through it, if you get a port put in, other than the tenderness of the port itself against your skin, there's really no discomfort whatsoever in utilizing it. I'm positive that once that bit of skin heals to the point where I can push it in and there's no discomfort, or touch it and there's no discomfort, that I don't believe getting the needle that they stick into the port is going to be any big deal at all. They do have medicines that you can rub on it an hour before. They have a spray medicine that they can spray on it, but they say it's just as discomforting as having that one-time stick in. So, we tried it without anything. I can say it was absolutely fine. Maybe not the thing I would have preferred to do, but it was still just fine. I was there from 8 a.m. They told me to expect to be there for a full day, from like 8 a.m. to 5 p.m. through everything that I needed to go through the video, the doctor's appointment, the sitting in the chemo chair for 3 hours, and then getting the pump. This is my portable pump that they loaned me. And again, it has a tube that goes up under my t-shirt. It's kind of taped around, and the needle part of it goes into that plastic or rubberized port. I was out of there by 1 o'clock, was able to have lunch while I was there. One of the things they didn't tell us, or we at least didn't hear it, was that we probably should have eaten breakfast before we went. And, you know, we were there for enough time. Wife went out and got a couple of hamburgers, brought them back in. We were able to eat while the chemotherapy was going on. Very, very comfortable. I can't say that there was anything at all in that part of the experience that concerned me, made me uncomfortable. Nothing hurt. I went through the 3 hours of the medicines that they were putting in there, out of there by 1. No discomfort. I could have went out and ate again. Came home. I worked from 1 o'clock to 5 o'clock, the second half of my day. Nothing. I had a few soft drinks, some things to eat. Nothing concerned me at all with that. This pump that I have has medicine in it that needs to run for 44 hours, which means I won't be returning to return the pump and get it taken out until about noon on Friday. But at that point, they'll take it away. And from what I know right now, I will be without the medicines, without anything, until the following, I get a week and a half off. I get my treatments every Wednesday, so this one went on today, which is a Wednesday. It'll come off on Friday. I get from Friday clear through the whole next week, back to Wednesday again, and then I start the whole thing over again. Some of the stuff that I'm reading out on the web says about the time they take this pump off, I may start feeling some nausea. I may start feeling some side effects, such as being fatigued. They tell me that's my body trying to heal itself from what the cancer medicines do. I have no idea what that's going to be like, but I plan on bringing you a video of it every day. I may have to skip some days where it's just non-eventful, where nothing has happened. But when I do, I'll try to keep the day number in order, so that you can see it chronologically as I move through time. If I have days that I'm ill, I'm hoping that I can bring that to you and tell you what I'm feeling. There's another gentleman out there on the web that has done similar videos. They have been a wealth of information to me, made me feel tremendously more comfortable. So I'm hoping that I can bring some of these videos to you guys to let you know exactly what this Folfox treatment in late 2012 is like, and what a 6-month regimen of it is. Hope you enjoy the videos. By all means, leave me messages. I'll do everything I can to answer them. And we'll wait and see what tomorrow's message looks like. Thank you. Bye.